Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello, and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Sara Figueredo, and she is the Research and General Director of the Institute. Doctor, how are you?
I'm very good, Luis. Thank you so much. Thank you for having me. I always look forward to our podcasts.
So, I believe we have a very interesting topic. It's about organ failure. In this case, I believe we're going to be talking about liver, kidney, and heart. Very important organs in our body, and how can the stem cells help these organs to regenerate in case we have some issues with them? How can the stem cells help to regenerate new tissue in these organs?
Yeah, that's of course a very good question, Luis. So basically, the stem cells, as you said, the stem cells help to regenerate and literally reconstruct damaged tissue. And so with organ failure, so with the heart, we have so much cardiovascular disease. Heart attacks are literally where the heart is deprived of oxygen for a limited time, and part of the heart tissue actually dies. So we have the heart tissue. We have a big one is liver damage from alcoholism, or the wrong diet, or hepatitis. Various different reasons for liver damage. And then, of course, kidneys. Kidneys are damaged very often due to um, diabetes, or again, a various number of reasons. So when there's damage to these tissues, a lot of people ask me, how do the stem cells know where to go if we put them IV? And that again is a really good question. What happens is all of these damaged tissues, any damaged tissue, whether or not it's an organ, or even if it's a blood vessel, or brain tissue, and of course this also applies to brain damage. So anytime there's a damaged tissue or a damaged cell, that cell, which is that specific cell, releases a specific chemical messenger. We call them cytokines, and these cytokines they're inflammatory markers. They're messenger signals that send these signals to the stem cells in order for the stem cells to know exactly where that cytokine is coming from. So the stem cells hone in on exactly what tissue has been damaged and where the tissue needs regeneration. And so that's how the stem cells work. And we apply the stem cells very locally as well as intravenously, in order for the stem cells to go everywhere that the blood flows, basically, and that's still every organ, really. And
And,
and
and, and let me ask you,
that's
doctor. So
mhm.
for this treatment, is it the same treatment for the three organs, or is it a different treatment, like a special treatment for each one of them?
Yes, very good. What happens is we apply the stem cells locally as well as intravenously, so that we are addressing this in as many ways as we can. And one of the good things about this is when we apply the stem cells intravenously, we will also we take precautionary measures to ensure that the the defense immune cells that we have in the lungs, especially the immune cells, don't attack the stem cells, which is a possibility. And so we take precautionary measures to avoid that, so that the stem cells can do their work. And yes, the stem cells will go everywhere that the blood flows. Plus, we do the local injections and do things specifically for a specific organ.
I see.
depending on which organ is damaged.
Cirrhosis is one type of hepatitis, right?
Hepatitis can cause cirrhosis,
Oh, I
yes.
see.
There are several types of cirrhosis. So there's alcoholic cirrhosis. There's even non-alcoholic cirrhosis, which is
Yeah, I
due
heard about
to
that. Yeah.
that's right, which is due to we find, especially in the Latin American countries, with diets that are high in corn and maize and peanuts, because these foods contain a fungus called aflatoxin. And even if these foods are organic, the aflatoxin does not die, and uh, and so this fungus causes havoc in our livers, and that causes non-alcoholic cirrhosis of the liver. And we see that a lot in the Latin American countries because of the high the diet that's really high in the corn and peanuts.
And can you tell us what would be, because this treatment is not only applying the stem cells, I believe there's more to it, and there's like a complete treatment that we do at the Institute. Can you explain a little further what we do for all the patients?
Yes, Louise. Yes, we do. So it's a very comprehensive approach, and like you said, we don't only do the stem cells. We do a pre-treatment protocol, which is a preamble leading up to the stem cell treatment. That's even that we begin even before the patient comes for treatment, and that can be key dietary changes, adding some key supplements, a couple of lifestyle changes, like being a little more mindfulness and getting the stress and emotions at bay, because it's really important. That's one of the things that makes us so unique, is that we don't only address the physical body, we also address emotional and psychological and even spiritual aspects of a person's well-being, because our complete and total wellness is not only our physical body. There's so much more involved. So we make sure that stress is controlled, and a little bit of activity, as well as even mindfulness and praying, which if that's appropriate for some people. And so that's really important that we address that. So we start with that. And then once the patient gets here, we do a total detox program, which entails a nutritional IV, as well as organic suppositories with B vitamin shots, which is the complete total detox program. And then we also start an age appropriate growth hormone therapy, um, as which helps the rejuvenation and sort of fortifying the body and getting it ready for the stem cells, and also getting the stem cells ready if we're going to use autologous stem cells, as well as oxygen therapy. And that can be in the form of exercise with oxygen therapy, or it can be a hyperbaric chamber. And finally, last but not least, the stem cell enhancement formula, which is a combination of key herbs and minerals that help, again, to fortify the body and the stem cells themselves. And part of these therapies go on for about 3 months post treatment, to ensure that the stem cells are humming along and doing what they're supposed to be doing. And
Excellent.
that's all entailed with the stem cell therapy itself, of course.
So may I ask you, doctor, why are these? Well, you are a Canadian born citizen, but why are you doing this in Guatemala?
That is, again, Louise, that's a very good question. I get this asked a lot, and why we're not in North America.
Yeah,
And the reason for that is I actually used to practice in Arizona for many years, stem cell treatments. And the laws, the FDA laws, and even Health Canada, they restrict stem cell treatment to a great degree. In Canada, at this moment, it's completely outlawed. Even PRP, platelet-rich plasma treatments, are limited as well, which are growth factors and so amazingly wonderful. And in the U.S., the stem cell treatments are limited in the sense that the stem cells can only come from the patient's own body, um, which is unfortunate because in many cases, using endometrial stem cells or umbilical cells or another source is very, very beneficial. We use endometrial as well as autologous meaning they come from the patient's own body, and umbilical in some cases as well. Another reason that I'm not in the US doing this is also because um, so everything has to be done in one session. So we can't grow or manipulate the stem cells in any way. So if we only have, a few million stem cells, we can't grow them in a lab and grow, and we call it expansion. We can't grow the numbers because in most cases you need hundreds of millions of stem cells for an effective treatment. And that's number two. And number three, we cannot combine the stem cells with any other component, whether or not it's even your own blood or growth factors from your own blood and platelets. They cannot be combined with any other um, component because it would be considered an unapproved drug by FDA standards. So, unfortunately, that really limits the results because of the limited scope of practice of the stem cells. And so that's what brought me to Guatemala
And
for
that is
that reason
very
also.
weird because the stem cell treatments are getting very popular nowadays.
Yes, in other parts of the world, you're absolutely right. They are, there in Latin America. There are many clinics. There are all the clinics are outside of the U.S. So it could be either Latin America. I know of a couple of clinics in Mexico, um, as well as China and Israel, and so a lot in Germany.
If
So
I'm not
there
mistaken,
are
also in
clinics.
Australia, but I'm not really sure. I believe I've seen
Yes,
some in Australia.
yes, that's right. Yeah. So any decent stem cell treatment will be available outside of the US and Canada,
Well,
unfortunately.
but if you're planning to come to Guatemala, let me tell you that Guatemala is the perfect destination to do these treatments because it's a beautiful country and we have a lot of things that we can offer. As far as 1 day tours, or if you, in case you want to do city tours, or you can go to Antigua, Guatemala, which is only 45 minutes away from the city. And like the doctor had mentioned before, we do have active volcanoes here. That's a show that you have to see. It's pretty safe to travel to these places, and we also have great connections with local tour operators, and we can also arrange these tours for you. But it's important to mention that we can also provide like an Airbnb place for you to stay and a chauffeur. Is that correct, doctor?
That's right. That is included in the treatment package. So yes, we have a personal driver as well as accommodations in a very comfortable first world type of an Airbnb. And so we have our patients well taken care of and worry free situation and treatment. And like you mentioned, I wanted to mention also because I'm a coffee fanatic
Oh, we
that
all
we
are.
have. That's right. We have a lot of the coffee farms. In fact, a lot of Guatemalan coffee is supplied to Starbucks, so it's worth mentioning.
So you can, we can also arrange those coffee farm tours if you're interested in that.
That's right.
Doctor, how can a patient, if it's interested in this type of treatments, can reach you?
Oh, yes. So we have many forms of contacting us. So they can reach us at info@stemcellhealinginstitute.com. They can also visit us at our website www.stemcellhealinginstitute.com or stemxcure.com, a little bit shorter to type. We have a Facebook page as well as Instagram. Our podcast can be found on YouTube as well as Spotify and Anchor. And they can reach us also by phone. A couple of modes of phone contact, and one could be by WhatsApp. It's plus 502 4220-7297. Our US and Canadian number is plus 1-209-690-7836.
Thank you, doctor. So there you have it. If in case you want to reach to the doctor, I believe you respond on your emails. Is that correct, doctor?
That's right. Absolutely.
All right.
Yep. We're very quick. We respond within 24 hours.
Excellent. Is there anything else you would like to add to this podcast, doctor?
No, Luis, I think we covered a lot of ground. Thank you so much for your input. And I look forward to seeing you next time.
Doctor, you have a wonderful day.
Thank you so much, Luis. You do the same.
All right. You take care. Bye bye.
Okay. Thank you. Bye bye.